cultural diversity and
Medio IGC 202, Unit 6. I'm Dr. Isabel Souza, your presenter for this unit. Let's talk now about the learning model. Berlin and Fowkes came up with a very nice framework for providers to have culturally competent discussions with their patients. So the first thing is to listen, and to listen to the patient's perception of the problem. Explain your perception of the problem. Knowledge, and discuss differences and similarities. And then recommend a treatment, which is really the first step, because then we have to negotiate that treatment. So typically, there will be something to this effect in a discourse between a patient and a provider, but it can vary. Sometimes it's just Q&A and the provider is simply asking a lot of close-ended questions and wanting the patient to respond yes or no, so that they can just simply go ahead and minimize all the options and sort of see what's not the case until they get to the diagnosis. This is a more holistic approach, and it's because basically there's a real conversation here, and the listening part becomes important, and then explaining your perception of what the patient said, meaning you're kind of teaching back and making sure that you understood exactly what the patient is saying, so that then you can fill in any gaps, the knowledge part, the differences and similarities, and then move on. So it's a more secure way to avoid communication problems. So let's move on to the next slide, where we're now going to talk about working with interpreters. So what are providers told regarding, working with interpreters? First of all, they're told their qualifications, right? That they're bilingual at the minimum, bicultural, that they understand English medical vocabulary and the other language medical vocabulary as well. That interpreters are able to interpret in the consecutive and in the simultaneous modes, and also provide sight translation services, reading a document in one language and relaying it, interpreting it in the other. The interpreter has a comfort in the medical setting, understands the significance of the health problems being discussed, and always preserves confidentiality, and certainly interprets everything completely and accurately. So if we continue, there's more here. So let's go to the next slide so we can see other things we tell providers. So we tell providers that, interpreters have multiple responsibilities. They're interpreting into, at least 2 languages. They're providing intercultural mediation when necessary, and bridging that cultural gap, not just the linguistic gap. And, they're advocating for the patient just as any healthcare professional would, conveying expectations, concerns, wayfinding, and ensuring and being cognizant of patient safety issues. So moving on, we can see here that we also give providers specific, guidelines on how to work with interpreters. First of all, to speak clearly. That's very important, because we remind providers that we cannot interpret what we cannot hear or understand. Minimizing jargon is very helpful. And providers, we usually see that, they're used to speaking in jargon. And jargon is great, but when you're using acronyms a lot, and we've discussed it with RN and PR, and there's so many different acronyms, and a doctor can say you need an MRI, but an MRI doesn't mean, the letters MRI don't mean anything in another language. He's speaking about a magnetic resonance imaging. So sometimes, we ask the provider to avoid jargon. Nonverbal communication is 60% or more of the communication. And just because it's nonverbal, it doesn't mean it's all body language. It can also be the tone of the voice, the intonation, hesitations. There are quite a few things that are involved that can give you a perception of what is being communicated. Nodding may indicate politeness, not comprehension. So that's a big one, and we remind providers not to rely on nodding as a sign of comprehension. In some cultures, nodding, up and down actually means no, and nodding the other way means yes, as in India. So we have to be careful not to make assumptions. The body language, providers rely a lot on interpreters to understand. Bilingual interview takes at least twice as long as monolingual interviews. So that's an issue, and that's sometimes why a provider may be a bit rushed, because he has less time to speak, basically. Now, for sign language interpreters, it's not a big issue because they do mostly simultaneous, but for spoken language interpreters, it can be an issue. And just like we don't want the provider to seem rushed, the interpreter has to be careful not to allow their voice or body language to seem rushed as well. So let's move on. Now let's talk a little bit about caretakers' responsibilities. Even learning and using a few phrases of greeting and introduction in the patient's native language can make a big difference. Just saying hola to a patient who speaks Spanish, for example, might just really break the ice. So this conveys respect and demonstrates your willingness to learn about their culture. So a lot of these, key tips that we're giving here, are helpful to providers because they also don't know how to bridge that gap. And any action they can do directly can be very useful. Also telling the patient that the interpreter will interpret everything that is said, and that they must intervene and interpret after every few phrases. Now, if they're working with a professional interpreter, they're not going to have to tell the patient this. But sometimes providers are working with individuals who are not professional. So on occasion, they do have to explain some of the same issues we have to explain. Let's go to a few more caretaker responsibilities on the next slide. So when speaking or listening, look at the patient, not the interpreter. That's something we tell them, in the introduction. And reinforce verbal messages with visual aids and material written in the client's language. It's really wonderful to see providers that really want the patient to understand, and sometimes they keep trying and they keep repeating the same explanation, and it's okay to suggest that maybe drawing something might be very helpful to the patient, or maybe having it written down for the patient in their language. Repeating important information more than once. So speaking clearly, slowly, and repeating information can make a big difference in aiding the patient in really understanding what's going on. So let's check out a few more caretakers' responsibilities. Always give the reason or purpose for a treatment or a prescription. Oftentimes, as we've spoken before, language has an embedded context or assumptions that are supposed to be known by everyone. But when you're from a different culture, you maybe don't know. If you've rarely taken antibiotics, you might not know that you have to take them till the end. If you're asking a certain question, you really need to think, do they know why I'm asking this question? Would it seem strange? Even asking a Muslim patient if they drink alcohol, even though it's, part of the questionnaire, and everybody's being asked that, can really, put them in an uncomfortable situation, and they can almost, some can become offended. So we just need to be careful of those things, and a little more explanation goes a long way. Making sure the patient understands by having them explain themselves. That's called teach back, and it's a technique that is being used more and more and being taught in medical school. And it's replacing the old proverbial, do you understand? And the reason is because studies have been done, and most people that hear, do you understand, will say yes. Now think about it. If they're coming from a cultural group that values, a power dynamic where the provider is, the all-powerful, or where they're just, doing everything they can to adapt themselves and to seem respectful of the provider, they're going to say yes, even when they don't. So asking them, can you rephrase what I just said? What did you understand? And then when they give their explanation, then you can fill in the gaps. And that's what, that learn model was actually doing to providers, and it's a way for them to check that they're understanding. Sometimes that's a way interpreters also do it. So if you hear something and you're not quite sure you understood and you want to interpret it, instead of asking for a repetition, you can also simply, when you're doing the clarification, say, this is what I understood. Is this what you meant? And then if the phraseology is good and the patient said yes, then we know we can interpret it that way. So teach back is very useful for all parties. Asking the interpreter to interpret exactly what is communicated. Well, they shouldn't have to ask us because that's what we should do. But if they're working with a family member for whatever reason, oftentimes they will have to do that because the individual might go on and on. Personal information may be closed, guarded, and difficult to obtain. So just alerting providers that, depending on the cultural background of the individual, that person may be very private and may have a very difficult time discussing certain issues. The patient cannot be requested to bring an interpreter to the clinic. That's a big no-no, and a healthcare organization can get in trouble for that. Let's move on here to one more slide on caretakers' responsibilities. In some cultures, it may not be appropriate to suggest making a will for dying patients or terminally ill patients. That would be the cultural equivalent of a death wish. So we have to be very careful in how things get phrased, and sometimes the interpreter may, even use a pre-session to discuss this issue with the provider. Oftentimes it's being discussed with family members, but interpreters typically know when this type of sensitive discussion is going to take place. But just alerting providers can be very important. The same thing with the word cancer or very serious illnesses. Many cultures believe that the terminology we use can actually manifest what we're speaking about. Avoid saying you must. Instead, give patients their options and let them decide. Now it's funny because this can backfire because in some situations providers do this and the patients say, well, I'll do whatever you decide. And then the provider says, well, I can't decide for you. You're going to have to make a choice. And sometimes that's just a bit of a cultural bridge that they have to close because in the US, ultimately, it's the patient who makes the final decision, but not in many countries. Let the circumstances dictate whether you will work with an interpreter on-site or remotely. Certain situations really benefit from an on-site or face-to-face interpreter, while other situations just simply require remote interpreting. So we will discuss this at a later unit, but the provider here, in this case, for example, is being alerted to go ahead and think about this, not so much as a preference option for the provider, but the circumstances and the communication needs, letting those needs, dictate which way to go, if there is an option. And just remember that a lot of these tips for this unit are really tips that are given to providers and healthcare personnel when they start working. Almost every hospital, at least, and large health center will have like a new employee orientation. And more these employee orientations are having some kind of segment about working with culturally and linguistically diverse patients, because some providers might be coming from an area where they don't see patients that are diverse, and maybe they've never worked with an interpreter, and all of a sudden they're in a situation where half of their patients don't speak their language. So these are great tips for providers in any sense in working with diversity. It's because we're different that each of us is special. And this is, such a beautiful quote, because it's what makes the case that diversity is beautiful. And if we didn't have diversity, the world would be the most boring place, in the universe. So it's the diversity that makes us who we are, and acknowledging our diversity and valuing the differences is, a step above just being aware of them. So this concludes today's lecture. I thank you very much for listening.